Fantastic. Well, thank you very much, Professor Dawson. It's really a real pleasure to have you here at the floor. I think most folk know me. My name is David Blaine. I'm a EP and Senior Clinical Lecturer here in the School of Health and Wellbeing. This is part of our FHW Research and Development Skills seminar series. Good to have everyone online and in the room as well. I know there's a HETA meeting going on at the same time, so I think we might drive some of our audience away. And we'll try and get better at advertising and putting reminders out as well. But enough about that. On to today, we're going to hear all about the MVLS Ethics Committee, and there's no better person to talk to us about that than Professor Dawson. Thank you.
I know, thank you very much. So, yeah, thanks. So, I'm pleased to say, though, that pretty much as of now, I'm no longer involved with the MVLS Ethics Committee, having moved to a different role. So that won't really change anything because Terry Quinn, who was the co-chair, will be the chair, and we've also now co-opted 2 other people as co-chairs, so we'll have more capacity to do things a bit more quickly, or at least that's the idea. So, yeah, there'll be some new faces. So what I was just going to talk about was just some general. I was going to keep it quite operational, and then we can have some time for discussion if there are any specific questions at the end. A little bit first, though, just to. I don't want to go through this too much because it's very much things that you'll be aware of, but I think it is helpful just to talk about it for a second because it kind of helps just frame how the committee view and think about things. So, what are research ethics? And the key thing is, often we get things like, is this ethical? People ask us a question, I want to do this, is it ethical? As if it's like a binary phenomenon, is that red or is that blue? Which isn't really the case. There is a spectrum of there's a spectrum of things, some of which are clearly unacceptable, some of which are clearly okay, and most things are okay in a context. And it's that context that's really important, because you could argue experimenting on humans, animals is inappropriate regardless, but there are contexts in which it's probably okay if certain things are taken into account. So we don't view it as a binary concept. We view it as a kind of map and framework upon which we take independent decisions about whether what people are proposing are reasonable. That's essentially, the function of the committee. So it's not about the right answers. There is a way of doing things. You must do things in this way. There are clearly minimum standards and processes that we have to follow. But almost everything is fluid and can be allowed as long as there is justification, appropriate risk mitigation, and things have been well thought through. Okay, so we view it as just, we don't view things as being ethical or unethical, but everything just requires justification. And there might sometimes be a slightly better way of doing things. And the background is obviously in the principles of the Declaration of Helsinki, where the welfare of a research participant and their rights is above the research. And the primary goal of the research is to generate new knowledge, but that can never be above and overviewed as more important than the rights of the individual participant. So we always look at the participant experience. And I've raised this just because it kind of explains when I talk about what we're interested in. We often get applications with 5 pages of, and that's partly because people just copy and paste their grant application, but we get 5 pages of the background and the science and why this question is important that mostly I couldn't really care about because it's what happens to the participant that we're interested in. And then we get half a page on that. That's the kind of difference in what, we want 3 paragraphs. What do we know about this? What don't we know? What am I going to find out? 3 short paragraphs, and then we want lots of paragraphs on what it means for the participant and their data. Everything is flipped, in that sense. And really, we look at risk benefit. Almost everything is on the table, and it's whether it's appropriate for the benefit that might bring to the community, to the individual participant, or to the participant's patient group. And I think, often, I think most people, if they were to be honest with themselves, have had periods in their life where they view research ethics as a pain in the neck and a tick box. And I think, I would be lying if I say that was the case, back when I was, doing my clinical research fellow post and PhD post. It's just another hurdle, another thing getting in the way of my work. And there are actually people very senior in this university, may or may not be in your school, let's keep it anonymous, who still feel that way, despite the fact, that they should know better. And it's there for a reason. It's there to provide independent scrutiny and protect the university. It's there to provide independent scrutiny of activity. But this is the most important point. How many of you actually, particularly PhD students, how many of them actually have the luxury of a group of senior people spending 2 hours in the evening reading their application and giving detailed feedback? Almost nobody. So it should be viewed as a positive. It really is a source of free feedback. It's people trying to make things work better, not just make them safer, but try and make the flow of the research activities better. And there's lots of experience, that people can offer. So we hope it's a positive. So what does it cover? So this is where we start to get into some of the sort of operational details. Most research projects require ethical approval. That's pretty straightforward. A research project requires approval if it uses human participants, human products and tissues, or human data. May impact on participants is in the documentation, but that's quite loose. You could argue that does that mean a systematic review that finds something controversial should get ethical approval? I mean, not really. So it's really if it's anything that involves a human participant, their stuff, their tissues, or their data. So that's quite simple. But then where it becomes quite difficult is that, what actually is research? And it's a much more difficult question, to answer in some cases. What's just an evaluation? What's just saying, we do this teaching course, I want to find out if it's good and what we might improve. I mean, is that really research or is it just an evaluation? It's part of your normal everyday practice that you should reflect on what you do and try and do it better. And we'll have a look at the document in a second. It's very clinical, that document, but it's because it's around clinical research, which strictly speaking, our committee isn't, which we'll come back to. But it does give a nice discriminator, if you like, between them. So we'll look at the document in a second, but it's surmised in these sorts of 4 areas. So how do I know if what I'm proposing is research? So the first thing is that the primary aim of research is to derive generalizable new knowledge. So by that, we mean if you're just asking a question, and you might be using students' data, you might be using other data. If you're just asking a question that is only really relevant to you in that course, for example, or for your clinical service, probably just an evaluation. But if you're asking wider questions that people in other institutions, people in other areas might benefit from, it's probably research. So if it's going to be generalizable out with your specific context, it's probably not just an evaluation. And obviously things like evaluations just measure, what are we doing? What are we doing here? What's our pass rate in this course? That's just an evaluation. Whereas, why are people failing? Is research, I guess. And trying to evaluate what we should be doing is research. And one of the interesting things that we often see, and where I think there's a lot of confusion, but things can be quite, this is one of the areas where we can be quite binary in our thought processes. Lots of information exists there, and your school would do this sorts of research more than any other school. Lots of information already exists, like routinely available data. Those data exist. And those data were collected without ethical approval because they were just collected in routine healthcare work or in routine social care practice or in routine educational practice. But they can be used for research. But the research ethical approval is around using those data that already exist, obviously. What we can have is a situation where people develop new sources of data and say it's an audit or an evaluation, but knowing deep down in 2 years' time they're going to do loads of research on it. And that we sometimes see those sorts of things, be tried. And I think, you know, the intent from the outset has to be really clear. Am I just generating data as part of my normal work? Or am I generating a subsequent wish to use it for research? And if that's the case, get approval at the very beginning. But of course, you can always come back and get approval to use routinely available data. So the intent of the exercise is critical. And if you're doing something normal, so, you know, in the clinical setting, this is obvious. If somebody's just getting their normal clinical care, unlikely to be research. But if you're doing something different to them, same in education, if you're trying out 3 different ways of teaching and you're going to decide at the end which one is best, that's probably a research exercise. So whether you're changing what people do, you're allocating or randomizing, then obviously it's research. So they're the 4 sorts of things that we look at when people, because we get asked this all the time, and we should be asked it, and we're happy to take these queries at least once or twice a week. We'll get a query through, I want to do this, is it research? And if somebody's described, this is the normal practice, and this is what I plan to do that's different, it's much, much easier for us to make that distinction. We get these queries all the time. It's probably the commonest query that we get. So I'll talk just a bit about our committee then before we take any questions. And this is really great, and it still remains a challenge. Our committee specifically is for non-clinical research, because clinical research used to be done within the NHS Ethics Committee. But many years ago, the NHS Ethics Committee changed their definition of what research was, and it moved it away from the university's definition of what research was. So there's a little bit of a hole that our committee has had to plug. So what we mean by that is that if you have a PhD student or member of staff, it's very often PhD student work, who want to do something like a qualitative piece of research with a staff group about care for people with cancer and how that might be improved. The NHS says that does not require ethical review. That is standard good clinical practice, that you would evaluate these things, you'd interview staff members, you would, it's not research, it's evaluation. Because they would, the committees just couldn't function because of the volume of work they were getting through. Whereas the university does define that as research, but then I could make the argument if I wanted to be lazy and say, well, it's clinical. Not my job. But then whose job is it? The NHS won't review it. We leave PhD students vulnerable if they're doing those sorts of works without ethical approval and then go to their viva. Things can get raised and lots of problems. So although our remit is non-clinical, those sort of clinical research that is not required to be approved, that is not approved or reviewed by the NHS committee, we would review to provide that independent ethical review. That should really be clarified and changed at the main university level so that the remit doesn't say it's non-clinical. It has a better way of wording, but it's quite complex to find exactly what that wording is. But it's just to explain that sort of gap. So this is stuff, again, you'll all be familiar with. The application form broadly follows those things that we think, that we want to know and that we review when we look at it. So summary and background for the proposal. And again, that can be super brief. What's the problem? What don't we know? How is this research going to address it? Really, really brief. Because we're much more interested in who are the participants, and I'll talk a little bit about often what the gaps are in some applications. Who are the participants? How will they be identified and recruited? And what we often get in applications, probably the biggest gap, is informed consent will be obtained. And that's good. But what hasn't been explained is how does that man on the street get in your room to get the to sign the informed consent form? So how is he identified? Is he cold called? Do you kick him in the shins? What do you actually do to get his attention? And then how do you give him the information? And then how do you translate that information into consent? So we need it to start from, there's a guy walking down the street. How does he actually get into your room, in a sort of blow by blow? And that's probably the biggest gap we see in applications. And then we want a blow by blow of what happens to them. And if it's a patient facing piece of work, literally to the point that, because a lot of our stuff, maybe not in this school, but a lot of the stuff, for example, in School of Medicine, it's all nutritional type studies. So literally, what does he eat before he goes to bed? You know, when they wake up, can they have a coffee? You know, all these sorts of things that are relevant to the protocol, and the same, how does the participant get to where he's turning up for the research project? You know, how do they get there? Are there any, so literally think of it as, I'm a participant, or I'm the participant's piece of data. How do I get from, you know, my bed or the computer that I'm stored on into the researcher's hands? And then how do I evolve into a research finding that's published and then disseminated to, you know, to the wider community? So we want a blow by blow of those things. How will they be identified and recruited? What will happen to them? What will happen to their data? Where will it all be done? How long will the data be stored for? Implications of the results and what will happen to the results. One of our big weaknesses is that well, police is the wrong word because we're not a police force, but we don't have good mechanisms at the moment to capture the last step. We're quite good at capturing what people say they're going to do. We're not so good at capturing what people actually do in terms of, you know, delivering the project. Is it staying with protocol? You know, are they doing things by protocol? And we're even less good, I think, at capturing what happens at the end of the project. Have you disseminated it the way that you said you would in your application? That's been highlighted in a recent independent audit, and there will be some changes to the system to support that. Special consideration, things to think about. You know, there's obviously special consideration for minors and children, and much of your research will involve schools, for example, in this school, and it's quite a challenging issue. I think the processes that certainly that I've seen within the school for those sorts of activities are extremely good and as well thought out as they possibly could be. But even with that and the decades of experience of doing it, we still, you know, it only takes one person to take offence at something and cause quite a storm. And some people have been exposed to those things, sadly. So, you know, there special consideration for minors, but I haven't seen applications, certainly from this school, where that hasn't been incredibly well thought out and dealt with. Deception and debrief is a big thing, obviously, in psychology. They're always doing deception studies where, you know, they bring somebody up and they're trying to look at subconscious biases. Well, you can't tell them, I'm here to see whether, you know, you have subconscious gender bias, you know, because obviously then they won't in their experiment, you know, so you have to deceive them and tell them you're doing this, but then at the end, what's your process for debriefing them and informing them that actually there was a bit of deception for this reason? Is it okay we still use your data? And as long as that process is done and it's scientifically justified, it's fine. Withdraw is not contentious right to withdraw. I think we all accept that if somebody wants to withdraw from a research study, they can, you know, and you would want that right if you were a participant. But it's clarity about whether that's actually feasible, particularly when you're working with data, is sometimes where we need a bit more information in application. Because of course, it's mutually exclusive to say this is anonymous, but you have a right to withdraw. Because if it's anonymous, how do you know? When somebody contacts you, how do you know who their data is? Usually there's a point at which you can, and then of course there's a point at which you can't, and that just needs to be clear in the application. And most of the time that's done. Don't need to talk about, I mean, we can pick up if you want in discussion, but in this school, you'll know more about dealing with data and confidentiality than in any other. So that's kind of the information that we need. How do we assess it? So we ask a very simple question: is this worthwhile? Almost always going to be worthwhile, you know, and that's why the background doesn't need to be massive. We're not a grant panel, you know, we're not trying to decide we've got $1 million and we've got 10 million pounds of pressure on it. We need to make some difficult decisions. That's obviously not our role. Our role is just simple. Is this justified? Is it of sufficient standard? Now, this is it's an important point because it's certainly in good clinical practice, GCP. So for clinical research, it's a matter of law. It's not quite the same for non-clinical research, but the university follows the same principles. So this is why we need the CVs. Again, it is a bit of a pain. I totally get that. But, you know, and most of the time, people, well, you know who I am. I know, but we can't demonstrate to the outside that we know who you are, you know. You know, it's far easier if people just upload their CV, because that's the only way that we can just quickly check, yeah, this person's done research before, you know. And so that's why the CVs are needed. It is a bit of a pain, but, you know, that's why it's there, is to make sure that we can verify that the researchers are of sufficient standard. Risk benefit we talked about, and certainly it's the blow by blow of the participant experience that we're really interested in. Common issues. I've talked about a few of these as we go. So I've been involved in the committee. I don't know how long, it's probably about 13, 14 years. And the standard of applications is really, really good. You know, there was obviously a transitional period for all of us when GDPR changed and things that you know, it was really challenging for everybody, not all researchers. That's now well past, and the standard of applications that we get, generally speaking, is extremely good. And these are the common areas that we still identify. We got an MSc student to do a nice summer project, you know, looking at past years of applications and thematically sort of analysing the comments that were sent back, and they do coalesce around similar things. So this is the main one. I've mentioned it already. How do you get from a potential volunteer to participant? And what's that bit before they get the PIS? That's probably the most contentious bit. You know, once you've got the PIS, you're face to face, the person can ask questions. It's how did you know who that person was? How did you get their email? Did you have a right to see it? Did you cold call them? You know, what was the mechanism? PISs are very often still not written from the participant perspective, too much jargon. You can check it on Word. The HRA guidance for clinical researchers in reading age of 12 or less is what we would aim for some of these things. And often people cut and paste from the protocol or the grant application for the start of the PIS. We need to know exactly what will happen to participants. And that has to be, you know, as much detail as is needed, but a blow by blow from, you know, start to the end of the protocol from their perspective. There's a lot of confusion still, and I still find it confusing when I write my own things, you know, which data are we talking about, you know, because there's really 3 sets of data. There's the stuff you need to do the study and the consent forms that clearly, you know, you may not, it may be totally anonymous, but for most studies that involve face-to-face contact, you have a consent form, so that's signed, so it's identifiable, and you need their phone number to organize follow-up, so you need those data. And then you've got your linked research data. So you've got, you know, somewhere it says this person's name, this is the participant, and then you've got your kind of almost anonymous research data, if you like. And then at the end of the study, there's probably no reason why that data can't be unlinked and made completely anonymous, and then it goes in a light and it goes somewhere else. So you've got those sorts of 3 types of data, and we all get confused about, right, when do I destroy this bit? When do I destroy the consent forms? And the university does have now fairly clear policies around these things, but still they get deviated from. So people say things like, I'll keep it for 2 years. Well, that's not, 10 years is typically what we say, or some people say 20 years. And again, you can keep it for as long as you like if there's a reason. It just has to be, you know, justifiable. And I think we've now got to grips with the fact that, you know, and I think people are starting to kind of be clear that in the applications outline, you know, these are my consent forms, they're identifiable, I need these for this amount of time. And if you're doing anything in the military, it's 100 years. If there's a clinical trial, it'll be 25 years. So it, you know, it does differ in context. So separate that out, then think about my research data. When can I make it anonymous? You know, probably the last time you need it, plus a month or so to, you know, a few months, a year to tie things up. And then you've got your 3rd set of data, and what am I going to do with that? Where am I going to put it? Am I going to share it? You know, and all those sorts. And again, that's getting much, much better now that we understand data sharing and those sorts of things. And
I'm sorry, can I ask a question, if that's okay?
yeah.
Thank you, Professor Dawson. So just on the topic of destroying data. So I think in my experience, it's used to distinguish between raw data, such as interview recordings, which my understanding is that we are encouraged to destroy them as soon as we've transcribed them, because it's data that we don't actually need, and we need to comply with the principle of data minimization. So don't keep data beyond the purposes that we need it for, but keep the consent forms for the 10 years, but destroy interview recordings as soon as we don't no longer need them. Is that fair?
Correct, absolutely, yes. That's a really good point. So So generally, absolutely, we would agree with that principle. There isn't a need to do it like ultra quick. Interesting when we speak to the governance office, they have said. So you're absolutely correct. You keep them for as long as you need them, but you don't have to delete them the minute you've transcribed them in case something happens or there's an issue. So you can, you could, for example, say audio files will be deleted. It could be at the end of the study. That's certainly what some people in the governance team think is okay at the end of the study, or once they've been transcribed and checked. So you're confident there is absolutely no purpose for this anymore. And again, it's that sort of clarity around wording is really helpful. Because you don't want to get rid of it before.
Yep. Perfect. Thank you. And may I please ask another short question, Professor Dawson?
Yeah.
Yeah, so can I just check that we don't require ethics approval for analyses of news articles that are freely available online? So content analysis of news articles, whether they be on a sensitive topic or otherwise.
Yes, that's a good question. I would say generally no. For news articles. There's an obvious extension then into, well, does that also apply to social media and other things? I think that's obviously different because they are individuals' data that has, they did it for a purpose and we are using it for a different purpose. And obviously that comes with some risk. But for newspaper articles, I think if we were asked about that, I would say no. Is there an example?
Yeah. So we've had a confirmation that it's a no. But the administrator said he would talk to yourselves, but never got back to me. But yeah, it's for example suicide reporting. So okay. News articles on suicide, so freely available online.
Yeah.
Content analysis, anonymous, without. Yeah.
Yeah. So these are areas where I would. These are areas that we're again happy to have discussions around, and we would certainly, I think, conclude that it didn't require review, and formal approval, but because it's a contentious area, yeah, people often contact us, and I think it's good to have those discussions. So again, to reassure yourselves that there isn't going to be a, for example, you come to publish it and then somebody raises, arguably inappropriately, well, did you do this without ethical approval? Well, you can then go back and evidence that, well, actually, we had the discussion and it wasn't required, and we can support that with, letters and documentation, which we do fairly frequently.
Thank you.
But in that context, I would say no, it's a good one, an interesting one. And the last question, research without consent. Obviously we do this all the time. You just think about research on data, routinely available data, it's without specific consent. And in a context that's appropriate, we do sometimes see applications that, they want to, for example, do some follow-up analysis of students that have left and the reason for not consent, the justification for not, the attempt to not do consent is it'll be really hard to track these people down, and that's maybe not justifiable. So if you are doing research without consent, it just needs to be justified as to why that is needed and what the risk benefit of that, approach is. I'm not going to talk too much about data protection. When GDPR came in, obviously it was challenging for everybody. It was very challenging for us because the Data Protection Office obviously didn't have enough staff to deal with all the data protection requests that came in. I find it slightly ironic because we have a half member of staff and they had 4 times that at the time when they weren't able to do it, yet it became the ethics committee's job to do it. Of course, we have more reviewers, but they're all just people doing extra, doing extra stuff largely through goodwill. So it was really challenging because when it first came in, nobody really knew exactly where it applied, and there was some inconsistent messaging, and initially only high-risk projects needed a DPIA and a privacy notice, but then the university decided that all research needed a DPIA and a privacy notice, and of course, You then have people that have been conditioned to one environment where it's only high risk, then being told they have to do another piece of paper, and everybody got quite unhappy. But I think we've largely won that battle. Fact is, it's needed. There is still some difference of opinion as to whose job it is to approve them and sign them off. The reality is it's the investigator's job. If it meets certain high-risk criteria, it goes to the Data Protection Office. But we've been given a kind of administrative policing role to check that they've been done. So although strictly speaking, we don't really review them. We do review them, but we're not really qualified, if you like, to review them and sign them off. Our job is more to check they're there and they make some sense. It's really the investigator in the Data Protection Office that the investigators sign them off. You know, it's not us that sign them off, it's the researcher that signs them off in the Data Protection Office. But we do have this weird kind of policing role because we're the only kind of governance mechanism by which we can store the fact that this has been done, you know, and regulate. But strictly speaking, it's not an ethical role, but we clearly do, you know, feedback on. But I think that battle's largely been one that these things are just needed. We just all have to suck it up.
Can I just check in? Does that mean that in practice, the Data Protection Office would only really be reviewing DPIAs if it's a high risk study?
Yeah, absolutely.
Hi, so like high risk means anything involving health. And on practical terms, like when I've been working with people, so I work sort of data management planning advice around our unit. So it's been like, if I think it qualifies for that, I'll say, right, do your DPIA, send it to the Data Protection Office. But don't wait for that to come back before you send in your ethics, because you're waiting months possibly. And I'm assuming that the MVLS ethics committee would then, like, if they saw the DPIA and thought it really was something where there was a high risk, they would say, well, we're not going to sign this off until you get your Data Protection Office review. Would that be the case? Well, until that's finalised. But actually, if the ethics committee look at it and kind of think it's quite routine, I mean, so it could involve health, but it could be very routine, it could be very straightforward. I think especially when I speak to people who are doing something quite novel or in a group that are particularly vulnerable, then I'll say, make sure Data Protection Office see that. Or if it's like new software that, you know, or something, then definitely say, absolutely make sure that goes in as soon as you can. But a lot of things are quite routine and they qualify as high risk, but actually there's nothing unusual about them. There's
nothing high risk about it, but except that definition.
Exactly.
So that's actually a very good point, because the question there is, so we are looking at our template letters again that we send back, and it's, you know, what we probably, so the risk would be that we gave approval, Data Protection Office hadn't looked at it, and then they came back and said it had to change. Now, that may or may not be an issue if it's sort of a living document and it can be changed. It may be an issue if it has a knock-on effect on insurance and a variety of things. So I will actually just pick that up and check, because we would routinely look at it and say, does this make sense? Even if it's, and then we would give approval. And we probably wouldn't know or be cited that the Data Protection Office hadn't approved. I mean, sometimes it's so obvious that we would check that and raise it, but there could well be, as you say, quite routine health-related stuff that we would approve where there's that missing gap. So I'll pick that up actually just to check.
Yeah, I think the reason
governance gap there.
Yeah, I think the reason there's such a wait is because if everything that qualifies as being sent as high risk is being sent to them, it's not surprising they've got this wait. But actually, if their guidance was a bit clearer, then they wouldn't have so many to work their way through.
I mean, one of the things we you know, do wonder whether we could formally be delegated some of those things, because, you know, people do look at them, and increasingly we look at them more and more. You know, initially we just had to check they were there, and then, you know, the governance team at the university understandably got concerned that, well, that means nobody's looking at them. But at least if we actually do look at them, it's better than nobody looking at them. But then whether there could be some formal delegation of specific types of thing is probably worth looking at. So yeah, I'll pick that up actually. Or I'll ask somebody else to pick it up. Now I'm no longer involved. So just very, very briefly, you've probably all seen it. I'm just going to open up just to show you, because we will be updating this again, but we spent a lot of time just after around, it must have been during COVID times, I think, actually, when there was a bit more time to do this sort of stuff. We developed new application forms for the main specific types of research that we see, to make them much shorter and much easier. And we also, for example, in the applications and the we this should work. We've added in quite a lot of text to help people with, what, and given kind of different options and things. So we've tried to make the applications as user-friendly and simple as we can, to provide a sort of common language that will mean that things don't get missed. So, there's a little bit of instruction for each section that you should fill in, and then some example, kind of text that you can copy. We've tried to do that across the applications and across all of the documents. And remember just to change the footers and the version controlling. We probably about a third of the applications come in with template and with the X's and stuff. I've done that as well. It's pretty easy to do. So have a look at that. And the other thing that is quite useful is, again, we keep adding to this because new things come up all the time. When we realize like, well, this is a problem, lots of people are asking about this, we try to add some frequently asked questions, information for applicants that might be useful. So you can have a look at that. But again, we've got a very much an open email policy where we're more than happy to deal with individual comments, and we can certainly deal with them quicker than we can deal with reviews. So that was all I was going to say, was just go through some aspects of the committee, some of the common problems, and happy to have any further discussion.
Good stuff. Thank you very much, President. Really interesting from my point of view. I'm open up to anyone else here. And while you're all thinking of a question, I wonder if you could just say a bit more about the independent audit that you mentioned. What's that, and is it open to review? Yeah, so I'm not sure if it is. I'm not sure where you can find it, but essentially there was a review, essentially an independent review of processes done by KPMG. I think we knew what it would find. And the processes of, it was really just looking at the entirety of process from the beginning, the end, of a research project. And, it highlighted the obvious things, like we don't have an online system for amendments. They're done via email, which at least is better than nothing, but, it's not ideal. Our processes for finding out when research, so for example, people ask, for a 3-month approval, and it takes them 3 months, they say, oh, I'll finish this project by the end of September, and they don't actually start it till August, and it goes on until December. Well, that's a real issue, because the university research depends on, or university insurance depends on ethical approval, which has lapsed, because, you've asked for 3 months and we've put 3 months in the letter. So again, we need to be much clever about it. So identify those sorts of things, and we don't actually have a process. We ask people to submit reports. We probably get 4 or 5 a year. And there's way more than that research projects done. So we are going to have to work with IT to have some sort of minimally invasive way of tracking what's being done. And whether, when research is ended, people know that they have to extend it, essentially when they're approaching the end. In the NHS, you get a letter. There's an automatic email generated, says your study's about to end. Is it finished? If not, request an amendment. And again, we need to build those systems. So that was the main finding of it. Just some issues around general training. Like there's a mandatory Moodle training for pretty much everything.
within the university, but not actually on research ethics, those sorts of things.
Good questions. You had your hand up.
Okay. So is everything from the audit going to happen?
Well, I think so. Yeah. The hope is.
Yeah. Did this come up at all in the audit? Like what people get really frustrated is that they get asked the same questions in the ethics form and the data management plan, and the data protection impact assessment, and also in like the information asset register. It's just like again and again and again. Was that covered at all? Is there anything happening around?
I mean, so that certainly wasn't a part of the audit, because it was really around process and yeah, I mean that is an interesting point. That there is duplication, absolutely, and whether there is a way of streamlining things even further. Yeah, it's definitely worth looking at.
Yeah, I think it's frustrating as it is for researchers that they've got to just answer this. The really frustrating thing is the inconsistencies that arise when you're asked the same thing 3 times.
Yeah.
Like, because you might only update it in one.
Yeah. Oh, that we see all the time. Yeah.
Yeah, and that is frustrating because that's a lot of documents that
Yeah.
can look across. So.
Yeah. No, that's a good point.
Thank you so much for the presentation. I have a question. What's the most common feedback you give for application that they want to conduct research in another country and doesn't consider any valuable clients? It's just interviews, surveys. What's the most feedback or comments so I can focus on it?
So I guess there wouldn't be anything. So the whole the research in other countries is a challenging area, because usually you still need some form of local approval as well, to conduct it. So we often end up where there's 2 sets of approvals, and that's frustration. I don't think there's anything specific. I mean, as long as so the main thing really is around the flow of the data and the data leaving the country. And that's probably the main specific thing, is that participants need to be informed, if a study is being done somewhere, that the data is going to leave that country. Well, it may not, but it's likely to leave that country and go to the University of Glasgow. That's probably the main thing.
And the local approval usually happens after the main approval.
Yeah.
So how can this is mitigated?
Yeah. So we absolutely, and in these studies we would really restrict any. I mean, we always try to be fairly pragmatic and not nitpicky, so we try, for example, if something's been approved locally in a second country, and there might be some things we would have suggested changing in our review, unless they're really important, we wouldn't insist on those things being changed. We do try to be a bit pragmatic in that sense, because they've been looked at, and if it's okay for the host country, who are we to kind of say it's not okay? For us, we tend to take that sort of view, and not be, ask for changes that aren't really that important, I guess. And it can be difficult, although actually it works fairly well, to be honest. We get these things all the time. It's really difficult.
There's a question online. Alexander Rodera, could you? Thanks.
Yeah, great. Thanks very much. Lots of really useful things to take away. I had 2 questions. One was on follow-on IRAS form. So maybe just to say, I've had some students fall into the category that you described of work with clinical staff that doesn't constitute needing to go to a rec committee. So they've gone through MVLS. And one thing that I've become aware of is that then there seems to be an additional step that they now need to make, where they need to put things together into an IRS form to satisfy the health boards that they're working in with the clinicians there. And I just wondered, I've heard a bit of it kind of secondhand through my students, but not been part of those conversations. I just wondered if you could give me a sense of what that process is about, and if you think that we're going about it the right way to do it in this kind of sequence, or there might be any smarter way to do it.
Yeah, so there is still a process of, if you like, a sort of capacity check that's needed, and it used to be R&D, now R&I approval. So if you're doing research in, for example, an NHS clinic or an evaluation, you know, they would say it's an evaluation, but you're doing a piece of work in an NHS clinic, there still needs to be that capacity check. But the university now has dedicated people that review those things, and the governance team are those that can give the guidance. And it is much more straightforward than it used to be. It should just be a really simple form saying this is the space we're going to use, this is the amount of time, you know, that sort of thing.
Okay.
But it used to be Imogen Galt that did all that work, but she's now switched roles. I'm not sure who's actually taken on from her. We can find that out.
That's fine. That's great, and that's more or less my understanding. I just wanted to check that we're not. There wouldn't have been a quicker way to do it or another order. Thank you. And then the other question I had was about transcription software. So it's been a conversation that has come up a few times about people interested in using things like the capacity that Microsoft Teams has to automate aspects of transcription, but some questions there about how that sits and whether that's something we can recommend. Just thinking to the future, where I guess these things are going to become more a routine tool that people will be expecting to use.
Yeah, I mean, so I think we do increasingly see that, and the only comments that we see reviewers put back is just around having something in around how it's going to be checked and verified, and not just accepted verbatim, you know, before you destroy the data, but as long as it's used and checked.
I think one of the questions, and this may, to be fair, this may not have come from MVLS, there's might be from another ethics context, is around the question of where the data is sent to be processed. So that thing about crossing kind of boundaries and stuff, which can be a bit opaque as a service, you know, as an end user, to really know how to account and explain that. Yeah.
I mean, as long as we're using, so that's why, I mean, I guess it's indirectly related. We do often raise if somebody wants to use something that isn't an official university, you know, kind of supplier or piece of software. But if people are using Teams, or I mean, there was an issue with Qualtrics, but you know, those different platforms that are university approved, then generally that's been taken care of, and we're content with that.
Great.
It's where it's something else, we need a bit more detail.
Great, thanks.
And so I'm probably not quite explained with this, but I guess I want to get a sense of how you combine their stakeholders. They suggested change. One turn to another. And I think I was setting my draft ready for you about that. So I just wondered, is that we should be saying?
Yeah, it has to be, unfortunately. Yeah.
I just want to make sure I wasn't being over the top.
Yeah, no, it does. It has to be. Yeah. Lovely. Yeah.
Just checking there's no one else. Secondary data use and ethical approval. How likely is it that it would require ethical approval? And like, for example, it's the UK Data Service. You sign in with your GU ID, and it's data that's released to you just from the standard end user license. Do you need to let MVLS ethics know that you're doing that?
Yeah, so we have this debate still all the time. So they're separate kind of types of those data. So there are some that have a very established governance mechanism and have a devolved ethics. So we wouldn't duplicate that process. There are some data sources that insist on ethical approval, and we might not necessarily think it was needed, but they insist on it. So obviously we would review and provide it. And then I guess there are, data sources out there that don't require it, you know, that you can access. And then there are other data sources where, you know, we often get asked, you know, can we use these data that have been generated in a research project, and we look at the original consent form, and it either doesn't say anything about future research, or it says if there's future research, we'll get ethical approval, and that kind of takes care of that answer. So I guess the one that's most contentious is the one where you allude, you allude to if it's a new piece of research, then I think it probably, generally speaking, they'll be completely de-identifiable, unidentifiable. Yeah. So if it's completely unidentifiable, then there's not a GDPR issue. I think then it comes down to, the risk of the research and whether there's any, anything that's the kind of last thing on that 4 checklist. So could it impact, people? Is it contentious? And it becomes very grey to define that. I mean, we have previously said, and it is written down, that those things don't require review. And I guess that is the answer, although we very often get these things submitted to us, but that usually is because they have, it's a condition of release of data that they have ethical, but that's really not the case for this source that you're alluding to. Is that right?
I haven't. Yeah. I just know that people have, like, both in MVLS ethics and in College of Social Science ethics, there's sometimes been asked to do ethics when they were quite surprised that they were part. Or they asked and were told yes, and they only asked hoping to be told. Yeah, absolutely. Or that kind of thing where they're like, well, this is quite straight. It's quite routine stuff that a lot of people do using the data. Yeah. So the key thing is contentiousness. Yeah, I think so. And so the UK, I think it's the UK Data Archive, say you have to have ethical approval, and there's a lot of projects I can't remember which one it is. There's, and some of the time we think, well, they have their own process. Why do we have to duplicate? They have a governance process. The data's all there because it's allowed to be used for research. Somebody checks. There's a committee that looks at it. Yet we still have to provide ethical, but obviously we'll do whatever we can to help.
I'm conscious of time is a couple of minutes. I wonder if you could just briefly say a bit about resources that the committee has. I mean, how many people are reviewing? How often do you meet? And the last one related is, are there kind of busier and quieter times of the year?
Yeah, sure. So we have roughly, so we now have 3 co-chairs. They review all applications, and we've cut back the amount of reviewing in the last few years because there were too many reviews. So simple low risk projects get reviewed by 1 person plus the chair. Higher risk for other projects. Anything with a sort of intervention would be 2 people plus the chair. We have somewhere in the region of 16 reviewers, and then there's a separate psychology committee because they review all the BSc projects. They have huge numbers of projects. They're about a similar size. And we review somewhere in the region of about 200 plus applications a year. So it's about 400 to 500 in the college as a whole across psychology and other ones. And we have, around 16 reviewers. So each reviewer does not that many a year. It's probably around every 1 to 2 months. And our target is to try and get comments and feedback back within a month. And that's a median. We hit that as a median, which obviously you could say that means we meet our target, but really means 50% of the time we don't. So we're trying to get new reviewers to help with that. And as I say, we've cut down the amount of reviewing from 3 for a complex project to 2, and 2 for an easy project to 1. And I hope that speeds it up. And busiest times are always projects, MSc projects. So it's busy in October for PhD students, and it's busy, really busy in sort of April, June.
Okay, that's 1 o'clock. So thank you very much again. It was a really
pleasure. Thank you. Topic, but here you go.
You made it captivating.